Last Friday, we signed a contract with CIAN Diagnostics to serve as our primary provider for COVID-19 testing. It's the same company we've been working with through the state for the last few weeks, so there will not be any further need to switch over or pause as the state's testing support fades out, and we have continuity with CIAN, who is the support we were getting from the state. It's a significant development for us, and I want to really thank our team for resolving this matter quickly and getting ourselves in a position that we can maintain continuity. We've been ramping up our testing operations. We're going to continue to do that, and at the mobile trailer at Lake Forest Mall. And so far, the turnaround for test results at CIAN has been averaging 48 hours. This is all very important to us. And just so everybody knows, we continue to be looking at the rapid tests. The governor has announced that he has tests. We don't know how many we're going to get, but we do know that their focus is going to be on nursing homes and other critical personnel. These are not meant for general consumption at this point, but the county is looking at companies that will be bringing these tests online, and hopes that we'll also be announcing progress in bringing those tests into the county. Obviously, we believe the more testing we do, the safer we can make people and the quicker we can get control on things. And the rapid tests have even more advantages than the tests we're using right now. Although we're ramping up testing, we continue to see a reduction in volume of the people coming in for testing in the county and around the state. And we're encouraging people to please come in and get tested. It's important to avoid spreading the virus. And we have to remind people that you may have the virus and not to be symptomatic. And that is the big problem with this. You don't know everybody who's sick. And so it's possible to be positive and spreading virus and not showing any signs of it.
The county executive mentioned that our numbers have been in the area, or test positivity has been somewhere between 2.9% and 3.3%. Over the last, since the governor's open up for phase 3 across the state and other jurisdictions, and since Labor Day, we've actually had 4 days that are over 100 or close to 100 cases in terms of testing positive. Now, when we look at our red cap numbers, again, the red cap numbers are breaking cases down based upon the day that the test was actually drawn, as opposed to the date that the result was reported in terms of how the state reports those. I do want to explain to folks at home, when they're asking where do the numbers lie, the numbers have been increasing in our jurisdiction, and we're continuing to follow those trends. Now, at the same time, we have not seen to date a comparable increase in hospital utilization or emergency room utilization, and our COVID-related fatalities have stayed low. We've had multiple days where we've had 0 COVID-related deaths. And in addition to that, we continue to see trends of a higher percentage of new cases coming from younger populations. Again, over 50% of cases at the state level and local level are between the ages of 0 to 30 years of age, and approximately 26 to 27% of those new cases are in the 0 to 19-year-old age group.